It was one of MLA Richard Starkey's platforms during his campaign for the Vermilion Lloydminster riding, making the issues surrounding seniors' care in our city known, not only in the legislature, but by the health minister himself. Today, Starkey delivered on that promise, as Minister Fred Horne met with the community stakeholders to tour the Dr. Cook Extended Care Facility, a facility that's been at the heart of an ongoing battle. Kelsey Bloxham has the details.
The south wing at the Dr. Cook had been slated for demolition next year, once a new extended care center on the city's west side is completed. But the teardown has been on hold since March, following a statement from Alberta Infrastructure saying other options for the older wing would be examined. Today, Alberta's Minister of Health and Wellness heard some of those options during a tour of the facility.
There's clearly a lack of, I think, a lack of good data to work with and a clear understanding of the health needs of the citizens here. And we need to do some work on that. 3
members from the Concerned Citizens for Seniors Care Group were on hand to meet with the minister, handing over a list of suggestions for possible uses of the wings, which he says he'll now review.
I want to spend some time talking to Minister Duncan in Saskatchewan. We have chatted a little bit about Lloydminster before. I want to find a way for us to follow up with the community on developing a broad healthcare plan for this region. And not just think of it as 2 provinces again, but think of it as a large regional service center.
But that work takes time, and how long it will take is unclear. But what is clear, the problem our region faces will continue until action is taken.
You know, it's gonna take some work to kind of emphasize the urgency of developing the plan. So I want to see it happen as quickly as possible.
For those with the Concerned Citizens Group who've spent the past 7 years advocating to keep the walls of the Dr. Cook intact, it's a message they've heard before.
The frustration on our end is that we've been listening to that kind of rhetoric for about 8 years since I've been involved in this, and most of us are getting a little tired of rhetoric and looking for action.
As for the future of the south wing of the Dr. Cook, it's still up for debate. Sellers says the group will now turn to the local health foundation for help.
We're going to write a letter to the local health foundation and ask them to help fund a study to get some actual figures on the costs of maintaining the Dr. Cook building. That'll be a project that we'll be embarking on here in the next week or so.
Kelsey Bloxham, Newcap News.
Imagine relying on emergency services with your life, only to find out the people helping you aren't exactly who you think they are. As Will Cortez explains, being a bi-provincial city proves to be quite difficult when it comes to providing the highest quality of care.
These blaring sirens can be the difference between life or death. But here in Lloydminster, it isn't a paramedic coming to your rescue. It's an emergency medical technician, or EMT, and an EMT can only provide basic life support. EMTs can only administer 10% of the medication a paramedic can. They aren't certified or trained on certain life-saving equipment, and even if professionals here are trained at a higher level, which many are, they can't use that higher training.
They're going to get the same care when they get to the hospital, but with a paramedic we can provide some of that care on the street prior to getting there. So it does help in a time constraint.
The reason why? Well, it comes down to dollars and cents. Emergency services are provincially funded, and it's making a sticky situation here in Canada's only border city.
Because there's two governing bodies, Alberta Health Services is responsible for everything on the west side of Lloydminster, and Prairie North is responsible for everything on the east.
Kendall says it's a matter of coming together and setting up a Lloydminster-specific protocol.
We'll keep trying to get and negotiate to get paramedics, and I truly believe that both Saskatchewan and Alberta sides want paramedics. It's just a matter of getting through the process.
The board recognizes the need and is very supportive of that initiative right now. So, we'll be working with the operator to move that way for the coming year.
But while the border is still a barrier, EMTs are doing the best they can, with what they have.
The service they're receiving, I believe, is excellent, and our staff are very well trained in what they're able to do, and at the level of service that we have here, they're getting excellent care out there.
Newcap tried to get in contact with our local government to find out why we don't have the highest quality of care, but Mayor Jeff Mulligan declined to comment. Will Cortez, Newcap News.
The Wainwright Health Center is an aging facility trying to keep up with the demand of a growing population. The need for a new hospital is there, but it's up to the Alberta government to decide. Today, the Deputy Premier and the MLA for that region toured the facility. Naramanisa has more on what they had to say.
I wanted to see it for myself.
The Wainwright Health Center had a few special visitors tour its facility. Alberta Deputy Premier Thomas Lukaszuk and Doug Griffiths, MLA for Battle River Wainwright, got a first-hand look at the building.
I don't think there's any dispute about whether or not a hospital is needed. That's a given fact.
A given fact, seeing how the facility is 40 years old. The infrastructure is small, the wiring is old, and many components of the building is just not up to par. Griffiths is no stranger to these halls. He's toured the facility 8 times in the past decade.
I'm impressed every single time at how the staff and administration in this place use every single bit of space. I mean, there is no better example of efficiency.
But while both officials say the need is there for an upgrade, it's not that easy. Renovating or expanding the existing building may not be the best idea. The government is leaning more towards starting from scratch. But in order to do so, the province would have to borrow money to pay for it, something the opposition is against.
With the way of funding infrastructure we're proposing, that we're really fighting for right now, you will see the hospital built much sooner than you would if we were doing things as we're being asked to do the old way.
While the hospital is on the agenda for the Tories, it's not quite a top priority.
Right now, this hospital is on the capital plan, but it's not on the funded capital plan. It's way, way, way down the list for funded projects. Once we are able to bite off bigger chunks of the needs that we have, your hospital will be much, much closer.
The facility serves more than 10,000 people in the region and is a big topic of discussion for residents.
This one's been here a long time, and it's a little outdated. I know we could definitely upgrade.
I think this one is, getting too old and it's crowded.
I think we don't need a new one, that's for sure.
So you think this facility is enough to handle?
For all the doctors we got, it's plenty.
There's no specific timeline as to if or when Wainwright will get a new hospital. The government says by the time it tables a budget next year, it will have a clearer picture as to where the project stands. Naramanisa, Newcap News.